In some patients who are under great stress and tension, they grind their teeth at night and hence end up with a huge masseter. The huge masseter will give a square profile to the face, but most importantly, with this grinding, it will wear down your teeth and you may not have a good night's rest because of the grinding. In this case, Botox is given to the masseter muscles to stop the movement of the masseter muscles so that the patient can have a good night's rest and they will not grind your teeth at night. If you have any other queries, please do see your doctor, or you can check out our website at www.sgac.com.sg.